We are deeply honored to have you with us here, Dr. Grunch. I'm going to start reminding everyone a little about MedSchool Mentors. We are going to record this webinar at our YouTube channel, and you guys can enter our YouTube channel and check the previous Leaders in Medicine webinars and our programs there. We are going to start launching new mentorship and research initiatives. So stay tuned. Make sure you subscribe to our channel and follow us on Instagram. Carlota will introduce our guest here.
Hello, everyone. I'm deeply honored to announce Dr. Betsy Grunch. She's a board-certified neurosurgeon at the Long Street Clinic and at Northeast Georgia Medical Center. She's from Georgia, and she returned to her hometown after completing her neurosurgery residency and spine fellowship training at Duke University. She's widely recognized as Ladyspinedoc on social media. And besides being a wonderful neurosurgeon and mentor and inspiration for all of us, she's also a mother, a wonderful mom. And we are so happy to have you here.
Thank you for having me. I'll say that I have laryngitis, so I don't sound very good right now. Apologize.
No problem.
No problem. So thank you for joining us, Dr. Grunch. We'll start with the questions. Camila is going to ask the first question. Camila? Okay, we can jump to Carlota. I think Camila is having technical problems.
Okay, so as I was saying before, you're really an inspiration for all of us. Because behind being a highly successful spine surgeon, you are also a wife and a mother of two wonderful child. And behind these, you also have inspired me and a lot of other people personally by showing that it's possible to step back at times and prioritize the personal health, the fitness, and the overall well-being. How you manage this balance between the professional demands and your personal life, always trying to do your best in both of the two?
It's challenging because I feel like in healthcare, like in medicine, like you can give, like there's never a time where it would ever stop. Like you can keep giving until you're done. So when we sign up to become doctors, we think that we have to do, we're felt to do everything that we can for our patients, and that's normal. And time away from that is abnormal, or is maybe not seen as doing your best. And I think that's just kind of the way, I don't know, we're trained to, like we're trained that 80 hours a week is normal. Like that's normal time. That's not like too much. So I think it's a different mindset. I've definitely grown over the years in terms of how I can best serve myself and fill my cups to where I'm happy, both at work and at home. And there are times where, like one day, if you take one day in time, I'm not always going to feel like the best doctor and the best mom. So I might feel like a really good doctor this day, and like may not feel like as good of a mom. And so like I want to try to balance that over time, so where there'll be days where I feel like I'm giving my all, to my kids or to my family. And as long as that balances out over time, then that's balance to me. Whereas, if you take a step back and you look at it and you're like, I'm always at work and I'm really abandoning this, you have to really step back and strategize how you can make it better, how you can fix that balance a little better. And it requires a lot of insight and self-awareness. That's difficult, especially in an environment where we're always taught to, like, we have to do everything all the time.
Yeah, I think this is probably the most important thing, because especially for us as a medical student, we are always under pressure, like to do more, to publish more, to like be always present, and the first that show up and the last that go away. And it's always like, okay, when we will enter into residency, and then when we will finish residency, and then when we will be maybe, I don't know, assistant professor. So you always try to postpone the moment in which you start to prioritize yourself. And it's hard because from one side you have this like really high pressure of doing better, and the other side you're like just asking when it will be your time to finally like prioritize yourself again. So
Yeah, it's definitely a challenge, and you can only be your best self whenever you're happy. And that's I mean, sometimes work does make us happy and working all the time, but you have to realize each individual person is unique into what makes them go and what makes them their drive. So you just have to have a lot of self-reflection.
thank you.
So, Dr. Grunch, um, with the power of social media, it's fair to say you've become one of the most well-known neurosurgeons worldwide. And given your massive audience and the communication reach that few physicians have ever experienced, what do you see as the most effective way to use your influence to benefit both patients and the medical field?
The best way that you can really be an advocate for everybody, for the healthcare industry, for your specialty, for your patients, for the public, is to really be your um, truest self, and combating misinformation and gaining a trust that is unbreakable or difficult to break, because it requires so much work to really gain that trust of people. So for me, it's been consistency and doing my best to be honest and transparent and authentic, so people know how I think, to know how I function in and outside of medicine, to know that I am a trustworthy voice on a particular topic. And a lot of that for me is really trying to stay the best in my lane, like where I feel the most knowledgeable, where I have the most expertise, where I can definitely exert my um, knowledge base in the best fashion. So I talk about this a lot. There's a lot of healthcare influencers out there that'll try to they just want to talk about everything. And we're not knowledgeable in everything. So like, I'm not going to be a good advocate about colon cancer or something like that, because that's not my realm. So I know how to respect my field and know where I can talk about things that I can really safely talk about and feel trustworthy to deliver that information. So
Okay, thank you for answering.
Dr. Grunch, so nice to meet you.
nice to meet you.
Congratulations on being named Mentor of the Year last year, and an incredible accomplishment, of course. And from your experience, what do you believe are the key elements that make for a truly supportive and effective mentor-mentee relationship in medicine?
I mean, the best way to be a good mentor is to really try to be available and honest, and really deliver a message to your mentee that of trust, because I mean, it also requires availability. Like you can't mentor like too many people, because you're only one person. So if you're going to be a good mentor to somebody, you need to be available to answer questions whenever they have them. And I think we try to overextend ourselves a lot. There's so many, I mean, where I'm at, like so many people reach out to be mentored, and I can't simply do it all, because then I wouldn't be doing a good job to anyone if I try to do it for everyone. So it's challenging, but just finding the right match, and those people that are that I feel like I can really like help. And it's just been people that are local to me, where I can really I mean, I do some virtual mentoring, but that's a little difficult. So,
And how about your own mentors? Of course, you've gone a lot of training, and what about your own mentors?
yeah, I mean, being a woman in this industry is um, always something that people ask, like, "Oh, who was your must have had a good mentor or whatever." But I think it's also important to know that like sometimes your mentors aren't going to be like who you might think they might be or what they might look like. So for me, a lot of the mentors, almost all the mentors I had throughout my career were men. And you know, they just helped, they really gravitated to me to want to help me with research or with, you know, papers or with guidance or suggestions or helping me get to that next level. And you know, as a student, you kind of have to realize that not everyone is the right match for you. And you kind of, I mean, not, you know, you're going to get turned down and that's okay. That doesn't necessarily mean a reflection on you. It's a reflection on the situation. And so you just kind of have to vet out who you think might be the best fit for you that can help guide you. And it may not be who you think it might be. So.
Thanks a lot.
I just want to remind everyone, we are going to let the last 5 minutes of our webinar for answering questions. So you can write your questions on the chat, and we are going to promote you to panelists before the webinar ends. You can go.
Thank you, Dr. Grunch. This is so exciting to finally get to meet you. I've been talking about it all week. This is like such a pinch.
Nice to meet you.
You as well. Thank you. So I'm very curious, through your Ladyspinedoc social media platform, you've encouraged millions of people and helped educate us through neurosurgery in an accessible way. I'm curious, what was your original motivators to do that, and how do you hope to help your audience furthermore?
I mean, like, I don't know if I really thought that I would be here like when I first started. So it was more of like I don't know, like let's, you know, create. I made a video that went viral about being a female in neurosurgery, and it really connected with a lot of people more so than I thought it would. And just speaking my truth and speaking my journey and, you know, the reality of what it is to be a physician, to be a mom, to be a person, human, um, is the most, you know, I guess the most important, I think. And that's really what pushed me through it, is to put like the basic face on what it is to be a physician, what that day-to-day life is. We're not just robots, you know, we have outside lives, outside interests, you know, decisions that we have to do. And just to put, you know, like a human face on it, I think is the most important. And delivering messages in an understandable way for people to understand. Because I think we sometimes in healthcare aren't the best communicators, or can break things down on an easy level for someone that has no background in a particular topic. So the more you do it, the better you are at it. So, you know, I've become so versed in trying to talk about things I learned from the comment section. Like, I didn't understand what you meant by that. Can you explain that? So, like, over the years and years of doing content like this, it allows me to be a better voice the next time around. So.
That's awesome. And to bounce off of that question that I recently had, I was curious, like, how do you go about challenges or criticisms as a physician on social media?
You have to realize that, like, you know, there's a lot of people have a lot of big beliefs about social media, and good and bad. I mean, you know, a lot of, like, I would say older school physicians, healthcare individuals think that social media is silly or unprofessional. I dealt a lot with that early on. But the stark reality is that most people go to social media to learn, to read about their news, to read about health information. And if there are not people out there that are putting out quality, genuine information, then there's 20-fold the amount of misinformation out there. So you have to have people that are willing to put themselves out there, face the negativity, face all these things that we go through as healthcare content creators, to see the good side of it and what benefit that we're doing for not only our patients and general public, but just to the future of healthcare and changing the face of what a physician may be in 10 years from now or 20 years from now. So it's pretty cool to think about.
It's awesome. Thank you.
So, Dr. Grunch, I remember you highlighted during your presentation at Mass General Brigham Grand Rounds how time consuming is to stay active and constantly innovating on social media. And actually, this is a part of that most of people don't know, that work behind the scenes. Could you share how do you manage your organizational routine as a neurosurgeon and a content creator and a mom? How does your schedule work?
Yeah, I mean, I feel like I'm always working. So like it's there's never a moment in my day where I sit down and think, oh, I don't have anything to do. So I just try to like keep a very organized schedule, and things that like maybe more priority, like prioritizing important things over maybe something that can wait is really important. And learning how to say no and to set up boundaries for yourself is incredibly important. So that's just a general life hack anyway, but more so the busier you get, like, you know, people want to overextend you everywhere, and to realize that you can't do that all the time is really important. So boundaries and organization.
Thank you. So we are almost out of time here. We have 5 minutes left. We are going to invite the audience to ask Dr. Grunch a question. So, Mia, can you promote Hassan Radwan to panelist so he can
Yes.
personally ask Dr. Grunch?
Yes, definitely.
Hassan, you can open your mic and your camera if you want and ask your question.
Hello, ma'am. Thank you so much, everyone, for this great chance to meet Dr. Grunch. Can you hear me?
Yes.
Yes?
I was just wondering about how are you able to maintain mainly the emotional balance between being able to have empathy for your patients and care for them, and when you go back home, you don't take, let's say, the work problems or the things that you have gone through, the cases that are most of the times might be even fatal, or people with disabilities dealing with much trauma. How are you able to separate between what you're having at the hospital, and how do you get like to live and care for your family?
I mean, it's difficult if you like want to open yourself up to that vulnerability, which you have to really connect with people. So, I try to take the aspect of like, if they're only going to hear me deliver this news once, and this might be the biggest moment of their life. So like, I remember the moment when my mom was injured and that doctor came out and talked to me. I relive it, every other week. Like, I know what that moment was like. And I want to try to make that experience for my patients, that or their loved ones, something that they would remember positively. And I try to be available emotionally and physically, but you have to be really careful about how much you open yourself up and how much you let it bother you. I mean, I try to say, I didn't do this. Like, I mean, I'm doing my best for this person, but ultimately what happened to them is it's reality of humanity. And it's easy to think of things scientifically like that, so you can reason. But some things just don't make sense, like a small, child that has cancer or something that just isn't fair. And you just have to realize that sometimes life isn't fair and things happen to good people, and you just have to like try not to let it affect you as best you can.
Definitely. Thank you so much, ma'am. And can I ask one more question, please?
Yeah.
Is there anything that you might have changed when you were preparing for applying for residency in neurosurgery? Is there anything in your like early stages in your career that you might have changed, or let's say might have regret not doing so?
The biggest thing is I wasn't really present for myself. So like I was giving everything for this field and the specialty and everything like sacrificed because I thought that was, I mean, at the time it was everything. So my health, I didn't really take time for me to stay healthy, to try to exercise, to, keep myself happy, and try to always do things that made others happy. So I wish I could tell my younger self that it would have been okay to do some of those things to make me happy in the moment. Because I think that's something that we always, someone I think mentioned about always thinking about the next step or the next whatever. We're always seeing the next. And so we have to like kind of realize that happiness is also in the moment, and it's important.
So we are almost out of time. Carlota will ask the
Yeah, I
final
have my
question
last
to
question,
Dr.
although
Grunch.
I think right now it kind of feel a little like maybe out of topic after what you say now, but I will ask it in any case. One of my favorite actor is Matthew McConaughey, and once he said in his Oscar speech that his hero, he's always himself 10 years from now. So if you can see yourself in 10 years, what will be like your goal for yourself as a woman in medicine, as a mom, as a like a mentor and a surgeon?
Man, I mean, that's a hard question, but I think as long as, I mean, how I want to be seen is just always that kind, you know, open, authentic person. And that changes over time and how our life changes. But I always want to be kind of known for that and to not lose that, like that empathy, that kindness, that human connection, because that's why we go into medicine. That's why what makes us do what we do and drives us. And we see it all the time in people that get too jaded or too distanced from that. And then they're not the same person. So I strive to want to continue to maintain that the best I can.
I think
Oh,
that's probably the best. Like looking at the future, always looking at the past also. So
Yeah.
Dr. Grunch, we are deeply honored to have you here with us. It was a
Sorry, I was
pleasure.
a little delayed. I had difficulty logging on at first.
Oh,
It's a
that's
few minutes
okay. It
late.
happens all the time. And I think that everyone here hopes that 10 years from now, at least we can achieve 10% of your success because you are a
Oh,
great
please.
inspiration to all of us.
Thank you for
Thank you
having
all
me.
for joining. And remember, this is going to be recorded on our YouTube channel. And don't forget to subscribe and follow MedSchool Mentor. Thank you, Dr. Grunch.
Thank you,
Grunch.
guys.
Have a good
Good
day.
luck. Bye.
Thank you.